Hello, everyone, and welcome to Aging in Place, the Greater Naperville Area's Family Guide. Our goal here is to help the sandwich generation, which is middle-aged adults typically in their 40s to 60s, who are squeezed by the responsibility of simultaneously supporting their aging parents and raising their own children. We want to help their parents age gracefully as possible and reduce stress through education and community connection. It takes a village, folks. And there are a lot of great resources and ideas that we try to uncover through expert guests that know the local area very, very well. I am your host, Dan Drews, and with me is my co-host and sponsor, Brennen Roberts, the owner of Seniors Helping Seniors for the Greater Naperville Area. And we also want to thank one of our other supporters, the Naperville Area Chamber of Commerce, who is a great advocate for all businesses that support seniors in the Naperville area. Brennen, good to see you again. How are things at Seniors Helping Seniors?
Oh, doing great. We feel like our work is very rewarding, getting to work with people all the time. And as you know, we help seniors kind of age with grace and live in their homes as long as they can. And we do it through non-medical home care, such as like companionship, activities, support with the house, activities of daily living. And we do it through this unique intergenerational model where our caregivers are primarily seniors themselves who are really able to connect with their peers on a good basis. So it's like getting help from a friend in many cases.
Well, it's a great model, and thank you for all the work you do in the Naperville area. I know we all appreciate it. So, folks, our show today is going to focus on how to prepare your parents and yourself for the steps of navigating Medicare and healthcare insurance in retirement. To help us with that, we are lucky to be joined by Sheril Hagie. Sheril is a financial professional and senior health consultant at Advocate Insurance Agency. She is qualified to assist individuals, families, and small businesses through the complex insurance world. Sheril spends most of her days educating clients on the best ways to implement the different insurance products that best fit their specific situation, from Medicare and life insurance to disability and long-term care policies. Sheril, thank you for joining us today. We're so glad to have you here. Can you tell us a little bit about what got you into this business?
My aging parents basically got me into this business. I took my dad on in 2012 after my mother passed away in 2011, and had to help him navigate through his insurance. Too expensive, was bankrupting him. Just, thank my parents for this. And,
I think that's what gets us in a lot into this kind of business. Brennan, I know you had a similar case.
Yeah, I think I've heard that a lot. That was a similar thing with me, trying to help my father navigate his way through the, home care, assisted living, nursing home, and just, if you're not familiar with it, it can be overwhelming for people.
Correct.
And certainly there's so many layers of it, just the care, but then the financial and insurance is just so confusing. And I know as a child trying to help take over his financials and preparing insurance, I was very, very confusing. So, I appreciate people like you that are helping our parents and other people's parents and stuff work through that, because it's so important and it's overwhelming.
Even in preparing for today, I've been impressed about all the things that I didn't know about. Call it red tape, potholes, everything we're going to talk about today. There's tons of it, right? It's everywhere.
There is a lot of it.
And
it's everywhere, and it's very hard to navigate for your seniors. I don't care how smart you are, how educated you are. It is a difficult thing to navigate.
And is that overwhelming feeling probably a lot what you get from your clients? They just don't know where to start or how to start?
Correct. Very overwhelmed. Received a phone call a couple of days ago from a woman. She contacted the Lyle Park District, and they gave her my name, and she's retiring. She's 64. She went on the website and couldn't make heads or tails of it. And she's an educated woman. Getting ready to retire. She even said to me, she goes, I've got 2 master's degrees and this is overwhelming for me. I'm not sure where to go, what to do first. I'm getting conflicting stories from friends and neighbors. And then you go on a website and you get conflicting things there. She said, so I just need help.
Yeah, you don't trust what you're going to get out of AI these days.
Correct.
I just think that's true, just a lot of things with the children, or anytime you're no matter how smart you are, anytime you're navigating something for the first time, and you really don't have to worry about it too much until you have to worry about it.
Yeah.
And then you don't know what questions to ask and where to go and what the resources
And
are.
people are also afraid of, in their words, messing it up, because it's going to be very hard to unmess up once you create that mess. If you click the wrong box, or you click the wrong date or enter in a wrong date for something, then you're going through another portion of red tape to get all of that undone.
Yeah. It's like me trying to put a sump pump in my house. If I know if I screw it up in the beginning, the whole thing's going to be a mess, right? But to that point, we need experts like yourself to kind of make sure that we're pointed in the right direction, so that we don't have to undo a lot of errors in the long term. So
right, and people don't know where to go. They'll call somewhere and they'll be like, "You do it all online. Just go online. Just Google it." No, you Google Medicare. I have it in one of my presentations. If you Google Medicare, you get some sort of crazy number like 3 billion responses.
Oh my gosh.
If you Google Medicare, it's crazy.
Yeah, it's everyone's wanting to get a piece of the action because there's so much
correct
money and insurance and care. So yeah, it's very confusing. So
why don't we start at the beginning about why this is so important, right? You had some stats that you gave us too. About 64% of future retirees believe that Medicare will cover their long-term care costs. Talk a little bit about what's the perception, I guess, and the reality.
So perception is that it's going to cover long-term care. There's people talk to their neighbors and they'll be like, my mom's getting paid for. Well, what they don't understand is their mom is on Medicaid. So, and that's a whole other animal. But Medicare will never cover your long-term care costs. Medicaid will, but you have to financially qualify to be on Medicaid. Most people are not going to qualify to be on Medicaid. The fact of the matter is, Medicare has never covered long-term care, and it never will cover long-term care.
Yeah.
So you have to, when you're sitting down and doing your financial planning, you're creating your budget, you're creating your retirement plan, things like that, you want to think about long-term care. Chances are you're going to need long-term care at some point in your life, whether it be early on or later or midway through your retirement. It doesn't mean that you're going to stay on long-term care necessarily. You could, depending on what happens, right? Nobody thinks they're going to have a stroke or a heart attack or Parkinson's or MS or something. It comes up later in life. You could have an event where you need long-term care for 6 months, and then you no longer need it, right? So long-term care is something that you should always put in your retirement portfolio. You should always talk about that. You should always think about that. Long-term care is very important.
And do you find that that's a difficult conversation for families, including the 80-year-old parents and the 50-year-old kids? They don't want to talk about it. Do you find that very often?
Yes, I do find that a lot. And a lot of it comes down to cost on a long-term care plan. Long-term care, there are several different types of long-term care now, where in the past, there was one type of long-term care and it was use it or lose it. So you're paying in these exorbitant amounts in premiums and you may never use it. And then it's just the insurance companies making out like a bandit, right? Because they're taking your premiums, you pass away, what happens to the policy? It goes away, right? There are other types of long-term care where you can have it and have beneficiaries. So if you don't use it and you pass away, then that money goes to your beneficiary. So that's where I run into problems with people, is they don't want to talk about it because of cost. There are cost-effective ways now to get long-term care. And the younger you are when you buy into it, the better off you are. I always say to people, if you're planning for retirement in your 30s, 40s, or 50s, have that conversation with someone. Put that plan in place now, because if you're going to pay for it on a monthly basis, your premiums are a lot lower.
Yeah.
And your premiums are your premiums. They don't go up as you age in a different type of long-term care policy. Now they do if you go into a traditional long-term care. That's my last resort, is something traditional that use it or lose it.
Yeah.
But it's very, very important to have that conversation when you're younger. Now, I'm working with a 76-year-old woman right now who's putting long-term care in place. She's very healthy. She is putting in a lump sum of money versus making payments. And you can do that. So she's pulling money out of a portfolio, and she's putting in anywhere between 100 and 150,000 into a long-term care policy, into an annuity, a long-term care annuity, actually, where she's going to have a bucket to pull from later on in life if she needs it.
Well, that could be an interesting strategy. We're talking with one of our financial advisor guests too, with some seniors that have RMDs, required minimum distributions, and you have to do something with that. That sounds maybe like a good avenue for that. Yeah.
Correct.
Yeah.
Correct.
Yeah. I mean, it's like anything. You should plan when you don't need it, because if you wait until you absolutely need it, then it's a problem. So,
yes.
Yeah. I think it's kind of interesting. It's just kind of throws you off, almost like the idea of like Medicare, when actually it's kind of like Medicare covers the cure, but they don't cover the care, right? So, like obviously in home care, we see that all the time where people are navigating they've had a health event and they've been in the hospital and they're going to skilled care, and then they're ready to come home, but they need help, getting to the bathroom, doing all that stuff, and they're like, Medicare covers it? No, it does not.
No, it does not. And there are policies out there for that. I'm partnered with a couple of different carriers that you can get a hospital plan, you can get a home health plan, cancer plan, things like that, and they're pretty inexpensive. I like to educate people. I don't like to talk at people. I want to educate them and on the things that are out there to help them. And they're pretty inexpensive. And the younger you are and you buy into them, the cheaper they're going to be. Like life insurance or final expense is what we call it when you're dealing with someone that's of the older age. My dad, I didn't realize he didn't have a substantial life insurance policy to bury him until he was 80. We had this discussion, and he goes, I have $5,000. And I'm like, hold up.
Not going to cover a lot.
Yeah.
So I wrote him on a $10,000 final expense plan when he was 80. And, it worked beautifully. Is it expensive? It depends. His was $100 a month for $10,000. He passed away 4.5 years into that plan, but then I had the $15,000 to bury him.
Yeah.
And if anybody knows, it costs between $10,000 and $15,000, depending on what you're doing, sometimes more, to bury one of your loved ones.
Yeah.
Well, I tell you, one of the things you mentioned there, Sheril, is wanting to help educate people. And for our audience there, regardless of any topic we talk about, you need to find folks like Sheril that don't want to talk above your head and confuse you with a lot of slang terms, but can sit down with you and walk you through it. So I applaud you for having that educator kind of mindset for folks that come in. And with that, let's kind of talk about the beginning of the beginning here as we get into how do you even start to sign up for Medicaid?
So for Medicare,
I'm sorry. Look, I'm already getting it wrong too. I'm glad we're having this show.
So for Medicare, you want to start the enrollment process 3 months before your 65th birthday. So you're going to start when you're 64. So 3 months prior to the 65th birthday, and you have the 3 months prior, the month of your birthday, and 3 months after. I never suggest waiting until the month of your birthday or 3 months after. I always want everyone to start 3 months prior because it's a process. You never know how long it's going to take to be approved. And by that, I mean, you're doing it all online now. They really don't want to help you in the Social Security office anymore. They will tell you to go do it all online. If you're not savvy online, it could take a little longer. You're going to need help. If the person helping you doesn't know what to do, then you're kind of in a mess, right? So you want to start that beforehand, the 3 months before, because I have seen it take 4 weeks, 8 weeks, 12 weeks to get approved because you're filling it out online. It's going to the Social Security office. So you sign up through ssa.gov through Social Security. It's going to the Social Security office, and it could sit on someone's desk, which in fact happened when we were calling on someone that we were reaching the 12-week mark and there was still no approval. It was on someone's desk at the Social Security office.
Well, I think you told me earlier that you had gone to the Social Security office recently, and then, bless them, but they're pretty understaffed. And you said there was like one person there helping out?
One person helping. There were 2 people waiting, and it was a 3-hour wait.
Wow, my goodness.
And I can help you navigate through this process. All you need to do is call me and I will help you. I'm a no-cost educator. So what does that mean? That means that my dad made me promise to help people and not charge them. And legally I could charge a consultation fee and help you sign up for Medicare Part B and A and B and walk you through the process and things like that. That's not part of who I am. That's not part of my business standard. My business standard is to educate you and show you how to do this and walk you through it side by side. That way nothing gets missed and you know exactly what is going on.
Yeah.
You need to know as the client or as the Medicare beneficiary how to do this and what's going on. Now, you're never going to have to do this again, sign up again, but you should know. You should be there watching. There are questions that I need to ask you that are on there. Some of them are not easy to understand, right? So I will sit there with you at no cost and walk you through this process. I will hold your hand.
Yeah.
When you first sign up for ssa.gov account, there's a third-party identifier on there. You have to be identified through id.me or login.gov.
Mm-hmm.
If it's your first time signing up, that's a whole other animal, trying to get verified through one of those 2 sites. And I've seen it happen. I've sat with somebody in Ottawa, Illinois, and we couldn't get her verified through either one of those because her email, she had gotten married, didn't change her name on her Social Security number, had 2 different emails out there, and her address on her driver's license didn't match the address of where she was living.
No kidding. So this site was just like, we can't confirm this is who you are. Wow. Okay.
So we ended up calling Social Security, and she did have to make an appointment, and she did have to go into the Social Security office to be physically verified.
Mm-hmm.
So yes, it can be troublesome.
Absolutely.
Trying to do this on your own. There's so many different factors that go into it.
To your point, you're like, even if you're 98% certain that you have the right answer for this question, like that, this is like, feels very important to get it right. I'm like, if I had an expert there helping me out.
Well, and there's also re-entry numbers and things like that. And it will say, print this page. Well, if you're someone that's not tech savvy, you don't have a printer, you don't know how to print that to a PDF and save it on your laptop, things like that. I will do all that for you. If you don't have an email, we will create you an email. I will help you set that up on your phone. We will send all those documents I'll save them all as a PDF and I will forward them on to you. So it's very hard to navigate. You have got re-entry numbers in case you want to save and go back in, and it's difficult.
Mm-hmm.
And anyone can set up an ssa.gov account at any time in your life. You don't have to wait till you're 64, 65 years old. I set mine up in my 30s.
Yeah.
Okay. And why is that?
You can watch your Social Security on there.
Oh, okay.
So you have to work 40 quarters in order to qualify for Medicare.
Mm-hmm.
And you can see how many quarters you've worked, how much, if you retire now, how much is your Social Security check going to be, things of that nature. I just signed my husband up. He did not have one. He's 54. And he watches it now. Once a month he goes in and he looks at it. And I'm like, you don't need to watch it that often, but because we're not
going to change that dramatically in a month.
We're not near retirement age, but so he's now set up with one. Yeah. It's just easier to set it up, I believe, when you're younger. I set up one for both of my kids. They're 26 and 23.
Yeah.
They both have an ssa.gov account because then they can see how many quarters have you worked. And there's a little green bar and it fills in as you're working. So it sounds
like a good recommendation most people wouldn't know about.
Correct.
go out there and sign up and set your account.
Yes.
It'll save you at least one step.
It
when
will
you get
save you at least
closer,
one
yeah.
step, and that's when I get phone calls. I will say, "Have you signed up for SSA.gov yet?" And they'll be like, "What?
What? I don't know. I
You'd
don't
be
know.
like, what's that? Yeah,
Right.
yeah.
And then your kids will be like, "Oh, my mom signed me up
Right.
30 years ago."
Exactly. And you want to save all your login info so you can get in and out of there and navigate the site. But yes.
Yeah.
Well, I was also interested to learn that you might be eligible for Medicare if you've got certain medical conditions too, like kidney failure and such.
Yes.
Like, without maybe listing them all, give us a sense of what that means.
So end-stage renal failure.
Okay.
That will automatically qualify you. I do have some clients in their 30s and 40s that are on Medicare. Traumatic brain injuries, things like
Really?
that, you can't work. If you are on disability for 24 straight months, on month 25, you will be enrolled in Medicare. I have a personal friend of mine. She's 45 years old. She was in a severe car accident in 2014, I think it was. Traumatic brain injury, a lot of head injuries. She had a stroke from this, and she has been on Medicare since that accident because she's disabled.
I imagine that enrollment process is probably even more difficult than.
Yes, so it's, it is what it is, but it's out there for you if you've been on disability. There are people that have children at home that are in their 20s that are on Medicare because they've been on disability.
Interesting. I bet you that is not a commonly known thing in the universe there. Yeah.
It is not.
Yeah.
You have kids that are born with muscular dystrophy, cerebral palsy, things like that have been in wheelchairs since they should have been walking, right? As they're growing. And yes, they do qualify for Medicare.
Yeah. Yeah. Well, I mean, that's great because it's obviously intended to be the safety net and healthcare for everyone who needs it. As we all know, our healthcare system is a little wonky here in the U.S.
Right.
So,
and they do have requirements that you have to meet to be on that, but you're going to qualify for it if you're not working, you have been deemed disabled, you've been on disability, for 24 straight months. You're going to meet one of the qualifiers.
The intent is not to have people fall through the cracks.
Correct.
So as long as
Correct.
You know how to navigate the system a little bit, hopefully you can get there. So
yeah.
But we talked a little bit earlier about kind of the timeline. If you could walk us through that again too, like when you should enroll in Medicare, and like if I'm coming into you for the first time, do I need to be bringing in my Social Security law? What sort of, I guess, documentation or things do I need in order to kind of
and I was also like you mentioned those dates too. Like does the government send you a notification like enroll in this, or is it just everybody supposed to intuitively know that
you will start getting stuff in the mail from the Department of Social Security and Medicare?
Really? Okay.
You will. And a lot of people think, because I educate on this, a lot of stuff you do get in the mail is a scam. So don't take that as like the word.
So what should people be looking for? Like what the logo from the Social Security
Social Security Administration Office, and they have that seal. Same thing with Medicare. So you want to look at that. Medicare.gov is the Medicare site. Medicare very rarely communicates with you. Okay. They're not going to 99. I'm going to say this: 99% of the time, Social Security and Medicare will never call you, but they do call sometimes. So I just had a client get a call from Social Security.
Interesting.
She had done something through her portal, and she clicked the wrong box, and they called her, and she called me, and she goes, "Is this true? Will they be calling me?" And I'm like, "What number did they leave you?" So I checked the number and I said, "Yes, go ahead and call them back. Something must have went wrong with something." And she goes, "I was in there messing around. I must have clicked something wrong."
Well, I applaud that person for being vigilant like that, because I'm sure as you run into it with your clients, there's scammers out there all the time trying to replicate,
And she was afraid to call him back. I made time in my day to go to her house and was there when she called. So we called together.
Wow, that's great.
Yes.
Great person
so
here.
you will get notifications. You want to pay attention to those notifications. I always tell everybody, open all of your mail. I find with a lot of seniors, they don't open their mail. And they will get stuff in the mail and they will say, well, I never got that. Yes, you did. Well, I threw that away. If you're ever questioning anything, call me. I will look at it. If you can snap a picture of it, if I'm in the area, I will come look at it personally. I have an office at the Lyle Park District in the senior center. You want to drop it off there with the secretary there, put my name on it. I'll look at it and I'll get back to you and tell you this is garbage or this is something that you really need to pay attention to.
I've got a question on that. I'm curious from your perspective. Let's call it over the last 10 years or so. Have you seen an evolution in the complexity or the, I guess, the capability of some of these scammers, right? Like, where stuff 10 years ago, stuff might have been in crayon, and now, boy, it's hard to discern what's real and what's not.
It is, especially with phone calls and AI now. Mail, I can pretty much tell if it's real or not in the mail. But phone calls, those are getting harder and harder to detect if it's scams or not.
Yeah.
With AI going on.
What recommendation would you give for folks if they get a phone call that they don't feel 100% confident in? What would you recommend? Hang up?
Hang up, block the number.
Yeah.
I always tell everybody, hang up and block the number. When I do my educational seminars out in public, I will show people. I'm an Android user, not an iPhone user, but I will show them on my phone, this is how you block a number. So say you have Humana insurance and somebody from Humana keeps calling you and saying they're with Humana, but it's a different phone number, they're not with Humana.
Yeah.
They're more than likely a robocaller, and they're trying to get you to switch your insurance. Happened to a client of mine in Streeter, Illinois. Her daughter called me and said, when did you change mom's insurance from Aetna to WellCare? And I said, I didn't. We didn't change your mom's insurance. Aetna is the best plan out there for her right now. And she goes, well, she's on WellCare now. And I go, what did she do? Did she answer the phone? What happened is someone called her. They told her they had a better plan. She said something, and they switched her.
Just on a verbal
okay over the phone.
Wow.
So we had to get her switched back. We had to use a special election period. We were able to get her switched back, though. So then we blocked that number on her phone. But unfortunately, I don't know how many scam calls you get a day. I get like 12.
Yeah.
You block them, and then they call from another number.
Yeah.
Right?
Yeah.
So
your strategy is like sometimes like get a callback number, then you can do a reverse lookup of the number, which is a little technical, but just you pop it into Google search, and it'll if it's associated with the SSA.
And they're getting creative through the mail too, and things like that. And I always tell everybody, I have clients. I'm pretty niche in what I do. Is I will do home visits. So if you don't feel comfortable coming to my office, if you want to meet me at a restaurant, I will meet you there. If you want to meet me at a coffee shop, I have one client loves to meet me at Bona Beef. I've met with her at her home twice, and now she wants to go to Bona Beef all the time, which is fine. I will meet you anywhere you want me to meet you, even if it's at your home.
Yeah. I know. I'm curious if there are tools out there like LifeLock and things like that that are designed to help protect people's identity and credit. Do those tools help in anything in your industry, or no? Is that
not that I've seen, or not that I'm aware of?
Yeah.
I personally have LifeLock, and it helps. I think everybody should have something like that, because somebody tried to buy a car in California with my social security number a few years ago, and I was notified immediately via phone call and email from LifeLock. But in the healthcare industry, no, not really.
Yeah.
I was flipping through the TV last night, and Dr. Oz was on. We all know he heads up Medicare and Medicaid now. And he was talking basically about the scams. My husband's like, change the channel. I'm like, no, I'll go upstairs and watch this because I need to know this. And there are so many scams out there. My dad was scammed with medical devices that he never received.
Really?
Yes. So they will bill your insurance. They will call you and say, do you have knee problems? Do you have back problems? And all they need you to verbally say is yes. And they can use that yes and apply it to anything
And so they'll charge you for a knee brace
that you don't even get.
that you don't ever get, and they'll bill it through
your insurance. They'll figure out who your insurance is. My dad was on Humana, and we got his EOB, or explanation of benefits. And I'm like, what are all these charges? And I called Humana, and I was like, please don't pay these. These are all fraudulent.
Yeah.
And there's a lot of fraud that goes on with Medicare and Medicaid.
Yeah.
So
Yeah.
Well, I tell you what, let's so get us back to I guess the enrollment piece too. We've got a grid or a chart here. Talk to us a little bit about what this grid or chart kind of helps us explain.
This grid is one of the things that I carry with me all the time to show people. So I made this grid. It shows you when you should start applying. So if you were, my birthday's in November. So when I'm 64 and I'm going to apply, I'm not going to wait till November when I turn 65. I'm going to start my process in August. August 1st, no matter what my date of birth is, my date of birth is November 5th.
Mm-hmm.
I don't start it on the 5th. I start it on the 1st of August. That's when I can go in and apply for Part A and B, okay, to get the process started. My end date is February 28th, 29th if it's a leap year. Like I always tell everybody, don't wait till February.
Yeah. Does the clock tick, like if you start the application process at the end of the period? Is that okay if it's not been approved yet?
Yes, it is, but I don't suggest starting the process, saving and exiting and going back in, because you're going to forget.
Yeah.
You're going to forget, and you might lose that reentry number. So you need that reentry number to get back in there. If you don't print it or write it down, you're going to lose that.
And when you say reentry, that's just basically you're saving your progress.
And they give you a number.
Pick up where you left off.
They give you a number, and they tell you to print this number or write it down, because they're going to ask you what that number is when you go back in to continue the process.
Okay.
So you need that number. So I never suggest starting and stopping.
I would imagine it's probably, even if you lose that, can you even restart a new one? Or
no. So you're going to have to call.
Yeah. Okay.
You're going to have to call. And wait times, hour, 5 hours on hold.
You said
3 hours in an office.
Mm-hmm.
Right. So you want to start that process. So if you're born in March, you want to start it December 1st, the year before. So you're born in March of this year, you're turning 65, March of 2026. Start that process December 1st, 2025.
Yeah.
Okay.
And is there any recourse if you miss the window? Like if you go past, can you do anything?
You're going to be penalized if you don't sign up for B and D in your initial enrollment period.
Okay.
Unless you have credible coverage. And a lot of people are like, what is credible coverage? Credible coverage is employer insurance, or you're on your husband or wife's insurance. That's credible coverage. And it has to be medical and prescription drug coverage to be credible coverage. Sometimes people don't retire till they're 67, right? And then they'll retire at 67, start taking their Social Security benefits at 67, because you get more at that point. I'm going through this with a client right now. She's insured until June 30th. July 1st, she will start receiving her benefits because she's retiring. And one of the questions when you go to sign up is, have you had credible coverage? You're going to click yes, and it will ask you, what type of coverage have you had? Is it through a union? Is it through an employer? Is it through a spouse? And it has to be one of those. Is it railroad? And they list them out. So you want to make sure you have credible coverage so you don't get hit with that penalty. I do have clients with Part B and D penalties because they did not enroll. A lot of the Part D ones, that's your drugs. I wasn't on any drugs when I was 65 or 67 when I enrolled. Because you don't have to enroll at the age of 65 if you're still working and have credible coverage. You can enroll for the first time at 67 instead of 65. If you're not on drugs, you still need a Part D plan. I don't care if it's just a 5 milligram statin that you're not paying anything for, or it's $3. You need drug coverage because you're going to get penalized later.
Yeah,
Ugh.
that is crazy. We started looking at this topic. I had no idea it was so punitive for.
Yes.
Can I ask, like, why is that? Is it just create more paperwork for the government, or is it just meant to be an incentive to get enrolled on time? Or?
I believe it's an incentive to get enrolled on time, but I'm not on board with the whole penalty thing. Yes, I do think there should be penalties, but I don't think they should be as aggressive as they are.
Yeah.
Right? So you are notified before you turn 65, hey, now is the time to start enrolling in Medicare, things like that. So you are notified. So I get the whole penalty thing, but 10%
for life.
For life on a Part B plan. So,
and explain that again. 10% of your coverage, or 10%
So
additional? What does that mean? Yeah.
It's for each 12-month period you go without Part B and do not qualify for an exemption, a 10% surcharge is added to the base monthly premium.
Oh, my
So
goodness.
if your premium for Part B is $202.90, which is the lowest premium that they offer right now, and your premiums go by income. So if you're on a $202.90, they're going to add 10% to that $202.90.
That's crazy.
Yeah.
For every 12 months you go without a Part B plan.
That's
Yeah.
For life.
Mm-hmm.
For life.
Yep.
Yeah,
so
that seems very punitive. Yeah.
Yes. So if you go 24 months, it's a 20% penalty.
Oh my gosh.
If you go, 36 months, it's 30% penalty.
Oh my gosh. That is a deadline you do not want to miss then. Holy
Right.
cow.
Exactly. You don't want to miss those deadlines. And Part D is the same way. There's different penalties for D than there are B, but a lot of people are like, I met with some people last week. They are like, neither one of us are on any medications. And I said, that's great. I said, I have a plan for you. We don't need a plan. We're not on medications, but you do need a plan because if you don't sign up for a plan, you're going to get hit with that Part D penalty. Well, this is dumb. Yes, I agree with you. I totally agree with you.
Not your dumb. This is dumb.
Yeah.
But, this is the law and this is what you have to do. There are $0 premium Part D out there.
Interesting.
Yes.
Okay.
Yes, there are. So for people that aren't on any medications at all, there are a couple of plans out there that don't charge a premium.
And even if it's like you say, a statin or your thyroid or whatever, doesn't matter.
Doesn't matter.
Yeah.
You have to have that Part D plan.
Yeah.
And your late enrollment penalty, they're permanent. They're for the rest of your life. And the Part D one can go up as you age. So if you go 63 days or more without credible coverage for a prescription drug plan after your initial enrollment period ends, you're getting hit with that penalty.
Yeah. We need to make a note. We need to send a note into Dr. Oz to fix that part of the program, man. That just seems very punitive for someone who's not using the program for a given period of time.
And to your point, if you weren't on any prescriptions, you would never think that you needed to enroll in that. So you just don't think down the road about that stuff. So
and a lot of people don't enroll in Part B either because they're not sick. There's nothing wrong with me. What do I need Part B for? Why do I want to pay $202.90 for something I'm not going to use?
Yeah. And high level, right? Not to take us down a rabbit hole, but quick, can you kind of explain Part B, Part D in generalities? Like what are the parts?
So you have Part A, which is hospitals and hospice are all grouped under Part A.
Okay.
Part B is doctors. Think doctor's visits, durable medical equipment, injectable drugs like your insulins, Skyrizis, things like that. That's all under Part B, as in boy. And Part D is drugs. So D, drugs. Part D is your drug plan.
That's right.
So you've got three parts. And then you have Part C.
I was going to say C.
You have Part C, which is your Medicare Advantage plans.
Okay.
Yep. So you have A and B. And if you just have A and B and D, you need a supplement.
Mm-hmm.
You need to throw a supplement in there to pick up the 20% Medicare doesn't cover. Medicare covers 80%. Medicare is A and B. That covers 80%. You need that supplement through a private carrier to pick up the extra 20, and then you need D for your drugs. Now, if you don't want to go that route, you can go an Advantage Plan route, and that is Plan C. That is A, B, and D all lumped together in one plan called C plan. Okay.
And that's provided by like
a private carrier.
Blue Cross Blue Shield,
just like your supplemental
like
carriers, they're private insurance carriers.
Yeah.
Interesting.
Which
Wow.
and that can be confusing too. Like again, I thrown into helping manage my dad's, and at one point he had an Advantage plan, but at some point I was getting the paperwork, I couldn't follow it, and at some point they changed he lived in a rural area. They changed the geographic area of coverage, so I thought the plan he would automatically, be enrolled in the same plan the next year.
No.
But I was overwhelmed by it, and I didn't realize it. And
and that's a whole other conversation between your supplement and your Advantage plans, your geographical area. Medicare is by zip code and county. So there's a portion of Aurora that is DuPage, Will, Kendall, and Kane. It's all 4 counties. So, and there's actually a street in Aurora where 3 of those counties come together on one street. So you've got people talking to each other in their cul-de-sacs, but they're all in different counties.
Oh gosh.
And one has this plan, one has this plan, and this one wants this plan, but it's not available. Well, why is it not available? I live right next door. Well, you pay your taxes in Kendall, they pay theirs in Kane, right? So different counties, different plans.
Yeah,
and your plans go by your geographical area. Will County, Cook County, they have the most Advantage plans offered because they have a huge population and they have a lot of medical centers, right? You live somewhere out in the boonies, say like Streeter, Illinois, where I was born and raised, there's not a lot of options out there.
Yeah.
Because it's a town of 12,000 people. They don't have a hospital there anymore. You got to be trucked to Ottawa or Rockford or Bloomington. So what they offer there isn't the same as what they offer in Ottawa, Illinois, right? And also Streeter's got a dividing line. They are LaSalle County and Livingston County. So one side of the street at 12th Street is LaSalle and the other side is Livingston.
Yeah.
Not the same plans.
Yeah, which can be even more confusing.
Right.
You're trying to help your parent through this, and
Right.
maybe you live across the street from them. You're like,
correct.
This is what I'm saying.
And that's a whole other presentation that I have. And so
it's funny.
I can clearly see why people come to you to be the expert on trying to navigate.
I know. It's funny as we've gotten into it. It's like Medicare is just the tip of the spear, and like
Correct.
how confusing that is. It's like long-term care is a whole nother topic.
Correct.
So it's like Medicare is the simpler part of the whole process.
Right. And that's why I educate versus sell, right? We all like to make money. I mean, that's what we do.
Sure.
That's how we pay our mortgage, right? But I would rather educate you first on what's out there. And I always tell my clients or potential clients, I will educate you on everything and whatever you want to know, but I let you make the ultimate decision as to what plan you want to go in for your Medicare. And the more eyes and ears, the better. So if you have kids, invite them in if they want to come. A spouse, invite them in.
I think that's a great idea.
Right.
Yeah, right.
So,
because they're going to have to know what mom and dad are signed up for.
Correct.
Like even like the story you shared where the daughter called you and say, "Hey, when did we switch?"
Right.
If she hadn't been knowledgeable about it, that we never would have known the switch happened. Yeah.
Exactly.
Yeah.
Exactly. And that plan, her doctors weren't in that plan.
Mm-hmm.
So
she's going to start incurring a whole bunch of out-of-pocket costs and
Correct.
not even be aware that it's going to happen.
Correct. So I first and foremost educate, and I want to educate to not only the parents, but their children if they want to be involved.
Yeah.
And there are some children that don't want to be involved, or the parents don't want them involved. You know, I will have children find out that they're working with me and call me and say, "Hey, what's going on?" You know, I can't legally tell them anything unless the parent releases that.
Yeah.
So it'll be a 3-way phone call.
Yeah.
And I'll be like, "Hey, Margaret, your child is on the phone. What are we going to do here? What do we want to do?"
Yeah.
Things like that. So you also have to be careful as well. But yeah, the more eyes and ears in a meeting, the better we are.
Well,
Yeah.
especially if one of the children has healthcare power of attorney,
Correct.
things like that. Yeah.
We always run into that. You want healthcare power of attorney. It's something I suggest,
Mhm.
even if you're healthy, is getting a healthcare power of attorney.
Mm-hmm.
Yeah.
Mm-hmm.
Yeah.
It doesn't, I don't care how old you are, especially if you're, not to change the subject, if your kids are going away to college, you need healthcare power of attorney on them because they're 18. We went through this with my daughter. Her appendix ruptured at college.
Wow. And the doctors couldn't tell you anything.
Exactly. Right? So you want healthcare power of attorney. I don't care how old you are.
Yeah.
You don't wait till mom and dad turn 65. You know, it's not going to kick in until something happens anyway. It's not like you can go say, okay, pull the up. Well, you could do that, but okay, no, we're not doing this. They're of sound mind and can make their own decisions. It's not going to kick in until they're not.
Yeah.
Right.
I've had the same thing. Like, you're so worried, like navigating. I don't know how far away your daughter was, but like you're hours
6
away.
hours.
6
Yes.
hours. You cannot be there. Like, I want to talk to a doctor. What's going on?
Right. And
I want to help. They're like, I'm sorry.
right. She's on the phone and giving me permission to talk to them while we're driving down to Missouri.
Stressful drive.
You know, so so you
drive.
always want medical power of attorney or healthcare power of attorney.
Yeah, yeah. I mean, one of the things we've said with lots of previous talks we've had with previous guests is like, just start the conversations early with your parents. You know,
Correct.
ask questions. It doesn't have to be like give me access to your bank accounts. Tell me what your stuff is. You just asking simple questions.
Right.
You know, like, hey, how do you get your prescriptions filled? Like, how do you pay for it? Like, what do you got, that kind of stuff? And, you know, and you can always, you know, couch it in the premise of like, hey, I was thinking about this, or I'm going to set things up for my kids and the estate. And,
I always did conversations with my dad. He moved in with us in 2012, and I wanted to know as much about him as I could for personal reasons, because I want to let my kids know, right? But also for selfish reasons, as I wanted to write his obituary when he did pass away to the best I could, right? He worked at this place for 45 years or 50 years. He loved to do this, this, and this. So make it as unobtrusive as you can when you're grilling. I call it grilling your parents. Like, I would just go in and sit on my dad's bed and be like, oh, hey, so, you know, when did you do this? You know, and I had a book that I wrote everything down in. So if you're just talking to them and being like, oh, where do you get your drugs filled? Because I might want to go there. Mm-hmm. You know, make it like that. Mm-hmm. Do you have a healthcare power of attorney? What if something happened to you when you were in a car accident?
Yeah.
You know, what if somebody rear-ended you or something and they had to take you via ambulance?
Yeah. Or you tell the story your daughter, like, oh my gosh, we didn't set it up with her, so we set up my daughter. Like, who's yours? We need yours.
And that was one of the first things we did when my dad moved in, is he hired an attorney, he did a will, and he did a healthcare and financial power of attorney. So we had it in place. He was not in good health when he moved in. That's the whole reason he moved in, because he was not in good health. But you've got to have those difficult conversations, but don't make them a difficult conversation if you can help it.
Yeah.
You know, just go in and just make it a regular conversation and slip things in here and there. Then when I wrote my dad's obituary, everybody was like, how did you know all of that?
I had the book.
Well, I had 10 plus years. Right. 10 plus years of talking to him. Just in a conversational manner. And then I would write it all down. And it's easier for you too, as the adult child, when something like that does happen, because now you've got it all written down and you're so upset when something happens, you're not racking your brain and forgetting something. You can just slide that paper across to the funeral director, which is what I did. And, you know, it's all right there. But you want to have that conversation too about healthcare, about insurance, about, do you have life insurance? Like, I should have had that conversation long before I did with him. Do you have long-term care? You know, things like that. Maybe we should start looking into this. You know, don't be demanding. Which
we had talked about with our financial planner, just the National Association of Insurance Commissioners report about how much billions of dollars go unclaimed because people don't know that their parents had life insurance policies and stuff. So always good to start early and have those conversations, and, you know, Again, it's not like
Right.
ripping off a Band-Aid. It's just like,
Yeah.
you know.
No, and especially with
That's crazy.
Medicare, you've got to have these conversations because you don't want them hit with these penalties, right? Because these penalties follow them until they pass away.
Well, let's kind of circle back to that too. We've talked a lot about these penalties and the penalties for not enrolling on time in Part D. When that happens, I imagine people are pretty distressed. Is there anything they can do to fight the system, or are they kind of stuck with the penalty?
They're kind of stuck with the penalty.
Okay.
I have some people, a handful of people that are on penalties. I did have a woman in Bolingbrook write our senator and congressman about it. Of course, she got nowhere, but it made her feel better.
Yeah.
And I applaud her for that.
Yeah.
For taking the time to write, because she didn't know she had to. And she had no defense because it's in the Medicare and You book every single year. It is posted online. You are mailed stuff that does say if you don't enroll, you're going to get hit with a penalty. But she overlooked all of that because she didn't have anybody to help her. So, in Part D, they're both following you, but Part D goes up as you age, as the national base premium goes up.
Yeah.
Right?
I mean, that's the part that really sticks with me, and that I didn't know it before our conversation today, is this penalty that goes into place that now you're stuck with forever, essentially.
You are. And the older you are, the higher it is, because as you can see on the slide, it's 1% of the national base premium. And you multiply that by the number of uncovered months and round to the nearest $10.
Ugh.
So right now it's $38.99 is the base premium.
Yeah.
So my example, if you delayed enrollment for 20 months, you would pay an extra $7.80 a month. 20% times the $38.99 equals $7.80 on top of your monthly plan premium.
In perpetuity.
Yeah.
Yeah.
And as that $38.99 goes up, your penalty goes up. So
I gotta ask, what's the latest? What's the biggest penalty you've seen? Like, what's the latest somebody's come?
The biggest penalty I have personally on my books is $24.99.
Wow.
So
yes.
Wow. So like 60% of that.
Yes.
On top of that.
Ugh.
Yes. And if you're someone that's on some high dollar drugs, most of the time a $0 premium plan isn't going to be good for you. So you're going to be paying a premium as well for that drug plan on top of the penalty, then the premium, and then your drug costs, right?
Yeah,
so a lot of people might not be able to afford that.
Yeah. Well, especially if you're on a budget, that makes a big impact on the bottom.
It does. It makes a big impact. So education is key. Paying attention is key.
Yeah, Sheril, are there any other topics that we haven't hit on today that you think we got to bring up before we let you go from our conversation today?
So what I would love to bring up is enroll online. If you don't have help, call me. Call somebody. If you don't like me, if you don't want a female, I don't care. Call somebody. But call somebody that's knowledgeable on this to help you. It is hard. Like I said, you've got to enroll. You have to know what's going on. Nobody wants to be paying all this extra money to the government if they don't have to. Okay?
Yeah.
We pay enough.
We pay enough as it is. You don't want to be paying anything extra if you don't have to. Education is key. Start the process. I don't care if you're 60 or 63 and you want to come and have a conversation with me, I'd be happy to do that with you. Just so you know what's coming. Okay, you've got to know what's coming. And you've got to start this process when you're 64, not 65.
Yeah, and I would say if you're in your 50s and you've got aging parents, encourage them to make the call.
Correct.
And make sure that they are as prepared as they need to be as well. So this is not just if you're going into it, but if you're the children of people going into it, make sure your parents are on the game.
Yes.
Yeah.
And make sure you know where you're applying. So you're applying at ssa.gov.
Yeah.
Or you can call the Social Security office, or you can book an appointment at your local Social Security office. Now, I will say, when I was in there a week or two ago, trying to get some booklets and stuff, they were not taking appointments at that time.
Really?
Yes. So I don't know if it was just that particular office, but I did hear them say they were not taking appointments anymore. at that time. So strictly walk in, and there's a wait time, and they are understaffed. So you can call, you're going to wait on the phone forever. I had one person tell me she hung up after 4 hours.
Oh, 4 hours.
Wow.
Oh,
So ssa.gov is going to be your friend. And just do it sooner rather than later.
Well,
So,
and Sheril, I applaud you. You mentioned it a couple times. You've got a heart of an educator. And I think anybody in this space for aging folks or the kids of aging folks really needs that for topics like this, because it's important for them to not only go through the steps, but understand the steps like you're talking about.
and that
well.
is key. You want to understand it. You don't want somebody talking at you, because then you're never going to understand it.
Yeah.
You've got to have communication back and forth. They need to be asking me questions in order for them to understand it. If I feel like they're not comprehending what I'm saying, I will print stuff out, or I will just jot down notes, or I will type up notes, and I will give them to them when they leave and be like, so this is what we went over. If you have any questions, call me. I don't care. Call me. I had somebody call me at 10 o'clock one night. I answered the phone. I normally don't. I answered the phone because I knew the phone number. And I was like, there's got to be a problem here.
Yeah.
You know, and I always tell my clients too, if there is a problem and you're you've been taken by ambulance to the hospital or whatever, and it's the middle of the night, my phone goes to sleep at 10 p.m. I'm not going to lie. Wakes back up at 6 a.m. If I think it's somebody that's going to have a problem, I will put them in my favorites list, and then that phone call will ring through. If you're somebody that you're calling me during the day, during business hours, and I don't pick up and you've left me a message, my message says 24 to 48 hours for a return phone call. If you can't wait that long and they just keep calling, I will answer the phone, even if I'm with a client. Or I tell them, text me 911.
Yeah.
Don't call 911, but text me 911 that it's important.
Yeah.
You know, I need to call you before the 24 or 48 hours time frame that I give in my voicemail. I'm generally always calling you back within a couple of hours. Anyway, but education is key. Having other people in the meeting is key if you can. And just starting the process when you need to start the process. 3 months prior is when we actually need to start it. We can't start it before. We want to start it at that 3-month time frame. But if you want education before that 3 months, call me. I will help you through the process.
And what's the best way? Should they call or email? Either way, fine.
Either way.
Okay.
Either way is fine with me. They can call me. They can email me.
Great.
Text message is okay. I get a zillion a day, so sometimes that might get overlooked. So a phone call with a voicemail, if I don't answer, or an email is a lot better.
Sounds good.
Than a text message.
We could not appreciate having you on today's episode more. You've been fantastic. I applaud you again with your heart of an educator, you know, trying to teach people about this topic as well, because I tell you what, my head's spinning even just from the conversations that we've had today too. So,
I wish we'd had this conversation several years ago.
I know, but I'm going to go back now and I'm going to have a conversation with my parents to make sure that they've got everything buttoned up too. So, Sheril, thank you again for taking the time with us today and helping us navigate all this topic and assist our seniors to continue to find them a way to age in place and kind of have a fulfilled and healthy retirement. We really appreciate the knowledge. And Brennen, thank you as always for being a sponsor of the program for Seniors Helping Seniors and helping bring these educational pieces to the area. We appreciate that as well.
Thanks. Well, as we say, it takes a village, and there's a lot of great people out here like Sheril out there looking out for people. So
it takes a village for sure.
Everybody.
Yeah. Well, listen, folks, we look forward to you joining us next time for our newest guest, and look for more content on some of these topics on our Facebook and YouTube pages as well at Seniors Helping Seniors Greater Naperville. But until then, folks, as we've said, it does take a village, so do your part in the village. Thank you for joining us.